Me in the tanning bed. 22 degrees outside. I'm thinking about bronze skin here on Mondale and Jones.
Mm-hmm.
It's 9:43 in the morning.
It is.
Our guest, as we mentioned earlier, is Dr. Charles Crutchfield, a dermatologist at Crutchfield Dermatology. Dr. Crutchfield.
Good morning.
How'd you come up with that catchy name?
Hey, speaking of looking bronze, I have the latest edition of the Minneapolis St. Paul magazine, and I think you look just great.
Hey, thanks.
I think she looks a little sassy, don't you, Dr. Crutchfield? She sort of has that look on her face like, I don't exactly know why you're breathing my air. That's the look.
Well, I'll tell you this about tanning in this time of the year. I mean, a lot of people are trying to look good for holiday parties.
Yes.
And this is a time when people are thinking about vacationing. So that's something I get asked all the time.
Is it okay to tan in the tanning bed?
In the tanning bed, and here's what they usually say. I just want to get just a little base. So when I go down to Acapulco or Arizona, Florida, I don't get burned. Now, here's the deal with it. Tanning causes skin cancer. There's no way around it, but the sad thing is it's a delayed reaction. What you get from tanning now, the results you'll see in 15 or 20 years. So what I recommend is get the look, because I know it's socially acceptable to have that nice tan look. And there are great centers that do mist and tan, and there are great lotions you can get over the counter. They've really perfected them now. They give you the tan look without the skin and DNA damage.
They're not the bright orange of yesteryear.
Yes, you don't look
QT.
like a carrot
Was that
anymore.
what it was, QT?
Yeah,
and,
quick tan.
Yeah, and then sun in for your hair, so you had orange hair and orange skin.
And orange skin. It looked like
Very
carrot
natural.
top.
Although Susie's got orange hair.
I do, but it's my
Natural,
it's my
yeah.
hair. It's my carrot top. But now, Dr. Crutchfield, seriously, I know this mist tan is out there, the car wash that you go in and it sprays you. But do you think even with all this information, it's going to stop teenagers or young women from doing the tanning bed thing? Even with all this information?
No, it's certainly not. I'm a realist. But the thing is, some of the new sunless tanning lotions, they look so good. I've actually started talking to my patients about the dangers of tanning, and they say, no, I'm using a self-tanning lotion or the mist and spray. So you're right. It's not going to stop it, but I think it's really important when we have the knowledge on the medical side to educate people, hey, don't damage your skin. Don't give yourself skin cancer years now. And especially it's good to protect children as they grow up, because really the parents and grandparents are more responsible. They found that most people get 80% of sun exposure by the time they're 18. So the cruel hoax is by the time you're kind of smart enough or wise enough or mature enough to protect yourself, it's almost too late.
Dr. Crutchfield, have they worked on the smell of the self-tanner stuff?
Yes, they have, and that's been one objection. It's getting better and better.
Oh,
Yeah.
that's good.
Yeah, because I used to go in that sweaty yoga class, and you could just run as far away from the self-tanning person in the class. Like, oh, I can't take it.
And I've seen the self-tanners evolve from the main complaint was the orange color, and they've solved that. And then you're right, the next complaint was the kind of aroma associated with it, and that's really minimized.
Dr. Charles Crutchfield, our guest, a dermatologist at Crutchfield Dermatology, talking with him about sun tanning in those beds and how bad that is for you. But if you have a question about anything dermatological.
Oh, that was good.
How about that?
That was good.
989-9226, 1-800-327-8255. You can use 612 or 651-989-9226. Again, 1-800-327-8255. Dr. Crutchfield, the part that worries me most, and I think Ellen and I may be sharing this, is that we did a lot of that stupid tanning ourselves when we were in our 20s, and now we're in our early 40s. And when should we, if we're going to see melanoma from our baby oil tanning days with the tinfoil around your face?
Yeah, with the reflector.
Reflecting mirror that focuses the rays on you.
Yeah, and the bed. You could get a
little
reflecting
sheet.
bed
Yeah.
and then the face reflector.
Mm-hmm.
So for us, being in our middle 40s, when would we start to see a little dot?
Well, here's what I tell patients. See spot change, see a dermatologist. Very simple. Any mole that's changing at all, size, color, shape, or spots that are bleeding easily without provocation. So some people say, when I use a razor and shave, it starts bleeding. Well, it doesn't count if you cut with a razor. But if you're using a cotton washcloth and you're washing and it starts bleeding, that's a reason to see a dermatologist. And I think starting at age 30, everybody should have at least one general comprehensive skin examination by a dermatologist. And at that point, based on how their skin looks and based on their family history, the dermatologist, he or she will recommend the frequency of general checkups after that.
I would say family history, too, is very important.
It's very important. And a lot of times we'll base Sometimes they'll say we need to see every couple of years, but if you have a strong family history, we might want to see every 6 to 12 months. But that'll be determined by the board-certified dermatologist at that point. And if you haven't had one at age 30, anytime, if you've never had one, you're beyond 30, it's a good time to get a good general comprehensive skin exam.
And how often after that?
Once again, it kind of depends on how your skin looks at the time and family history. Anywhere from once a year to once every few years.
All right, we have a call. Cindy is in Bloomington. She has a question for Dr. Crutchfield. Good morning, Cindy.
Good morning, and thanks. I was just wondering, I have adult acne, and I've been on pretty much every antibiotic, everything topical, oral, and I've been using Proactive lately.
Mm-hmm.
Is that, it seems to have worked better at first.
Yeah.
And now I really don't know if it's working anymore.
Well, it kind of covers the general philosophy of treating acne and adult acne. Oftentimes there are two theories. You can either use medicines that will suppress it or keep it down, or you can use other medicines that tend to be more curative. The more curative medicines happen to be a little bit more aggressive and have higher side effects. But the medicines you're using are suppressive, but it's real common. You use a medicine for a while, it works great, and then it kind of stops working, then we switch you to a different class. And that's kind of the nature of the disorder. So you use medicines that are either suppressive or curative.
Cindy, thanks for your call. We're going to take more of your calls coming up at 612 or 651-989-9226 or 1-800-327-8255 for any of your dermatological needs. We have Dr. Crutchfield with us. He's going to stay with us, and we, Mondale Jones, will be right back. It's 9:53 in the morning. Mondale Jones here on a warm 22 degrees day outside on WCCO. Our guest, Dr. Charles Crutchfield, dermatologist at Crutchfield Dermatology, answering your dermatological questions here. We have Sue from Egan who's calling with a question. Oh, Sue, are you on a cell phone?
I am.
Okay.
Are you having a hard time hearing me?
A little bit. Just ask it quick.
Yeah.
Okay. Is there anything over the counter to use for rosacea? And if not, does laser therapy work? And if not, what works?
Thank you.
Dr. Crutchfield?
Wow, I give hour-long lectures at the university on all those questions. But yes, there are some products over the counter that do help. There's a new product out by Aveeno that has feverfew in it that helps with redness. Rosacea is really a term that covers redness of the face and redness with bumps. If you have the bumps, oftentimes you need to go to a prescription-strength product. So for the redness, I would try some of the over-counter moisturizers, and for bumps and pustules, you need to see a dermatologist.
All right, we're going to go to Jan next in Aiken. Has a question for Dr. Crutchfield. Good morning, Jan.
Good morning. I wanted to know what he recommends for tanning makeup to buy in the store.
Do you have a preference, Dr. Crutchfield? I know everybody makes it.
Sure. I mean, what's really popular with a lot of our patients right now are the new mineral makeups. And there are several. There's Jane Irondale, there's Glow Minerals, things like that. Patients tend to like those very much, and they're easy on the skin.
I use Estee Lauder.
Estee Lauder, that's another one that my patients say work very well.
I do. I put a little bit underneath my lotion, and then that's what I put for my face color.
Now, she tricked me on that call because I thought she was going to ask me, what do I recommend for dry skin? Because that's something that we see all the time, especially this time of the year as the weather's changing. Speaking of the weather changing, I want to tell Mike Lynch hi. I want to thank him for the nice weather. We both live in Egan. We bump into each other at the car wash every once in a while. He's got the shiniest car in Egan. He's looking great.
Oh, don't look at my car. Hey, I use for dry skin that Vanny cream.
Yeah, Vanny cream is great, but here's what I recommend with dry skin. Number one, use a real gentle cleanser, one that won't take the natural oils out of your skin. So you want something with a low detergent content. There are great over-the-counter ones. Dove is good. Cetaphil is good. Vanny cream makes a great one. So talk to the pharmacist, low detergent content. And then once you take a bath or a shower, pat dry, and then put the moisturizer on top of it. It does a couple things. It seals the moisture that your skin has achieved with the bath or shower, and it adds a little bit more. And that will really, really diminish the dry, itchy skin that you can get in Minnesota winters.
All right, Dr. Crutchfield, a listener called in wanting to know how to get rid of skin tags, TAGS, and why do they form at all?
Skin tags are genetically...
I've never heard of it.
Yeah, they're little teeny bumps of skin that usually occur around the neck and under the arms, sometimes in the upper inner thighs. They're genetically determined. One of my old professors in school called them the barnacles of life. You just pick up a few as you go through life, especially as you become wiser and more mature.
That's why we're covered with them.
So you can usually take those off with. It's a real minor surgical procedure that takes about 10 minutes in any physician's office.
What about a kid who has like little pimples on the back of their arm, or just like about little ones?
Yep. The little bumps on the back.
And we've all seen that. We're standing in line behind people in the summer when they're wearing like a sundress or short sleeve shirts. It's called keratosis pilaris. It's a real common condition. It affects about 30% of all people. In fact, it's so common, some doctors think it's just a variation of normal. But sometimes it can be a little bit itchy, and so with that, you'd recommend an over-the-counter hydrocortisone cream and a good moisturizer to make it look better. A lot of times you can't get rid of it completely, but you can certainly improve the appearance.
Both of my kids have it on their arms, and they're both like, Mom, what is this? And I'm like, I don't know.
I probably see it at least once or twice a day in my clinic. Patients are coming in for treatments on that. It's very common. And in fact, we have a whole page on our website dedicated to keratosis pilaris.
Is it age-related?
No, not really. I usually see it on the cheeks and the arms in kids, sometimes the thighs, and as you get older, it kind of stops occurring on the cheeks, and it really kind of stays on the back of the arms.
Well, we have about a minute left. Do you want to direct us to your website for more information or anything else coming up you want to talk about briefly?
Yeah, you know what? One thing that we're getting lots of things because of holiday parties, a new treatment called mesotherapy or lipodissolve, and it's kind of like liposuction without the liposuction. It's a series of little injections that melts away fat like magic, and we have a whole page on our website dedicated. That's one thing that's kind of new that's working well.
And how much is one treatment, or can't you say that on the air?
Well, treatment is about $200 and takes a couple treatments, so it's a lot less expensive than liposuction, and it really, really works.
Well, we'll be there, Eleanor and I, January 4th.
Can you swing by here today?
But anyway, we've got lots of before and after pictures and lots of stuff just on general skincare. That's the main thing. And a lot of things you can do to make your skin look better with over-the-counter products. And our website is crutchfielddermatology.com. It's like a crutch in a field with a C.
All right, sir. Good to talk to you.
Okay.
Dr. Charles Crutchfield with us on 830 WCCO. It's 9:58, the news.